Is there a way to learn do-it-yourself ABA that you can do at home or even in schools? I'm here to tell you there is, and our guest this week, Isabel C., talks about how her son started showing signs, was diagnosed before the age of 2, and how she learned to roll up her sleeves and do it herself. We also talk about weaning from a pacifier, which her son used 24/7 and now is down to nights and nap time only. We talk about picky eating a little bit, talking and how to get babbling to words. And finally, we talk about adaptive skills such as hand washing, toothbrushing, and things that may not seem like a big deal, but they really are. No matter what age your child or client is at, all of these skills really need to come together as much as possible in order for each child to reach their fullest potential. So let's get into this great interview with Isabel C. Okay, we have Izzy here, and we are going to talk all about do-it-yourself ABA, and we're going to talk about adaptive skills and just a whole bunch of things. But before we get started, thank you for joining us. And why don't you tell me and my listeners about your fall into the autism world?
Yeah, so hi, I'm Isabel. I am a registered nurse before I decided to be a stay-at-home mom full time. Um, I fell into Dr. Barbera's coaching basically as a just stressed and very concerned mom. Around 14 months, I started noticing that motherhood was extremely difficult. We were crying, screaming more than we were talking and happy. And just essentially one late night, I was just Googling things on the internet and I came across her one-page assessment and I just took it. Um, from there, it
And that's the digital assessment, right?
the digital assessment.
Which
Mhm.
Izzy, and she goes by Izzy or Isabel, so we'll kind of alternate here. But just to briefly interrupt, the digital assessment is still free. It takes 10 minutes. It's at marybarbera.com/assessment. And when you take that in your email inbox, you will get the actual printout of the one-page assessment, which Izzy is going to share with everybody here. We're going to share the assessment and the plan in the show notes or down below. So that's really nice of Izzy and her husband to allow us to learn from her experience. So you happened upon that, you got on my email list because you did the assessment. And what did you think when you found the assessment? Did you think it was just going to be a little quick quiz or tell you if it's autism or not? Or
Yeah, I didn't know what to expect other than I was like, okay, well, I'm just going to take this because there are certain traits that made me think autism. And so when I took it and he scored really low, um, that kind of got me thinking a little bit more. But at the same time, I was like, well, I don't really know how much of it to believe because he's so young. So of course he's not going to be potty trained and he's going to score a 0 in that aspect. Of course he can't dress himself or other things. So I was like, how do I really gauge this for my child's age and situation? So I kind of just put it on the back burner. And then a few months later roll by and we go to the pediatrician for the 18-month appointment. And it's at this point that I'm talking to the pediatrician and I take her assessment.
which
And
was probably an MChat.
yeah,
23 questions, and it is a standardized screening tool for autism, and they usually do it at 18 months and 2 years. I did a video blog on that. We can link in the show notes, but the MChat is very common. You can even take the MChat in the comfort of your own home to look at some of the signs of autism. So you did the MChat, you talked to her at the 18-month visit, and you both agreed
we
that
decided that, yeah, he had autism. So with that came a lot of sadness and unknown. But it is very much in my nature to, if I don't know something about a situation, I want to learn everything possible about it. And so at this point, I'd gotten home and we had set up an appointment for him to actually be diagnosed. And so we finally get that diagnosis about a month later.
Which
And
is record time.
yes, no, this is,
You know, he was diagnosed like at 19 months of age, 20 months of age. And that is usually, people tell me they have to wait 9 months to 2 years for a diagnosis. And it really is hard. But so you managed to navigate that pretty quickly. And a lot of people don't know that, like, general pediatricians can't even diagnose autism, even when it's clear, which
yeah, it's
without
sad.
specialized
Yeah.
training. Yeah.
Yeah. But yeah, so fast forward, so we start ABA, we go to this clinic for an assessment. And Benson has a lot of anxiety with new people and new places. And so we get there, and overall, we were just not super impressed. He was crying a lot, very uncomfortable with the situation, didn't love interacting with the people, just kind of dirty. He was putting everything in his mouth. By far, this was the youngest age group that they had worked with personally. And so overall, we just kind of left there. You know, it was during his nap time. This was a center that was 45 minutes away from our house. So of course he like missed nap time, was screaming all the way home. I was in tears by the end of it. I was like, surely I can figure out something. Like, if we want to start ABA later, you know, that's fine, but surely I can figure out something. There has to be something better. And it was when I got home and I put him down for his nap and I finally got him to sleep, and I was on my email, and this email comes up, and it was, you know, from Dr. Mary Barbera. And I was like, okay, I kind of know this name. I think this was like a, you know, assessment I took a few months back, but it was like, join now. We're going to start this group coaching. It's going to be very interactive, and we're going to meet on Zoom weekly. And I was like, okay, like, let's just do it. Let's just dive in. Let's try it. Worst thing, you know, it could be whatever, but I need to learn more about what they're going to be doing at ABA or what I can do to help him at home. And I loved that she had a nurse background. I have a nurse background. I love that she had a child with autism. I have a child with autism. So I felt very comfortable and could connect in that sense with her. And from the very beginning, the very first video, it was just like, you know, are you a troubled mom? That, you know, are you like, I don't know, like the unknown, and just like we're here to help. And like the whole premise is increasing communication and decreasing tantrums. And I'm like, that's all I want, is just for my boy to be happy and to smile and to, you know, just enjoy his life. So that's how we got started.
Yeah, so you were among the first cohort. It's still going on at the time of this recording, but we just did it mid-October to mid-December is when we're going to be done this cohort of group coaching, which is different than our regular offering, because in the past, and even currently, people that aren't in our group coaching cohort, they're getting a lot. They're getting the course, they're getting the community, they're getting once a month unstuck calls. But we know that if you can afford it, if you can afford the time and money, the additional time and money to attend a weekly call, to actually turn in your assessment and plan, turn in your videos, for feedback from my team and from me, you know, we're so on the ball amongst the first of the cohort to turn in your assessment and plan and your videos, and then also being open to sharing, having me share your videos and stuff within the group coaching format, that you were able to get more feedback directly from me about all areas. So we do want to dive in to specifically talk about some of the gains that you've made, and it's only been about a month, 5 weeks now into the group coaching, but you redid the assessment, right? Because even if you have an assessment done from 2-3 months ago, it's really good to get a fresh assessment. It's still free. I said it would be free for the first 1,000 people. And now I think the numbers, approaching 35,000 people have taken the assessment, the digital assessment. And you got scores, and this was done mid-October. You got scores of 28% overall.
Mm-hmm.
And then there's 3 chunks. There's self-care and daily activities, adaptive skills, which we're going to focus a little bit more on today. Language and learning skills, which is a 12%. So self-care was 29, language and learning skills 12%, and problem behaviors 44%. And like you mentioned, Benson is still under 2 years of age. So this is not a validated, standardized test, but it does go hand in hand with standardized speech testing from the white paper we did. We can link that in the show notes. It goes pretty hand in hand with the VB MAP scoring. If you're doing that assessment, it should go pretty hand in hand with the Vineland. And if it is ever really standardized and reliable, I would say that it would probably be most reliable for, say, 3 and 4-year-olds who should be conversational. They should be not having a tantrum with washing hands. They should be brushing their teeth and potty trained and those sorts of things. So you're right in that the 2 and under 2 population, but that doesn't mean these results aren't really super valuable. So in the group coaching and in my book and everything, we talk about taking this assessment, the first column, starting with safety, and the second column, her column, and developing a plan. And how were you feeling at this point once you did the assessment and were starting to develop a plan?
A lot better. So I could clearly see what it was that we were lacking, what we needed to focus on. Because if you don't know what you should be looking for, if you don't know what they should be able to do at a certain age, it's just very, it's just broad, and you're like, well, okay, maybe I'll teach you your ABCs today, but that's not what you need to focus on. You know what I mean? It's more like, oh, let's wash our hands. Let's focus on, not screaming when we get dressed, or
Yeah.
just
Or
stuff
when
like
you go
that.
out of your house or have a visitor
Exactly.
come in, or you're walking and he's in the stroller and some neighbor approaches, kids don't like certain things, especially when they're used to calm and quiet and just mommy and daddy, then they can get, problem behaviors.
Right.
So his strengths are that he sleeps through the night, which is excellent. He feeds self, although he is a picky eater, and so we're going to talk about that. He's nonverbal, but he babbles 1 to 5 sounds a day. Do you see that babbling up in the past month?
Yes.
Yeah.
So from months 14 through 18, he actually stopped babbling altogether. He was completely silent. And so that's when I first knew that there was probably a problem. But yes, since 19, 20-ish months to now, so 1 month, definitely an increase of babbling. He babbles all the time.
Good.
And especially since starting your course, I don't know why, but he used to be very just monotone and very just like mom, 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 like if he would talk. Like today, he was excited. He gets he just has more enthusiasm to his talking or his babbling, and more just intention with it. So that's been exciting.
And what kind of things is he babbling?
Um, a lot of it is mama, dada, but there's just noises. That's not, correlation there.
Yeah.
Na na na. Yeah, he just makes a bunch of random
Okay.
noises.
Okay. And
So
so part of the course also is to do a language sample. And for a child that is increasing babbling or talking, or isn't, maybe you want to do those language samples more frequently, like every week or even once a day, or get a list of things, new sounds that you hear babbling. And even though there's not a correlation between him saying mama and him knowing that's you at the moment, the fact that he can babble and physically say mama and dada, I would make sure with like the shoebox program that you have not just one picture, but several pictures of mama, dada. When I'd hold it up, instead of saying mommy or what he's eventually going to call you, I would say mama, mama, mama. And, just keep exaggerating hi, and help him wave as you say things in an exaggerated tone. And then some needs are that he's unsafe around water traffic and wandering, which is not uncommon, especially since he's under 2, but, just keeping him safe, getting swimming lessons if that's a concern, maybe in the spring. Okay, so he is a picky eater and he also mouths things and was addicted to a pacifier. So let's start with pacifier, because one of the things on the digital assessment is addiction to pacifiers, which seems to be a very big problem. It was a problem with Lucas way back, and it's a problem with a lot of kids. So describe his pacifier use when you filled this out, when you said he was addicted to the pacifier.
So he had a pacifier in his mouth 24 hours a day. Had to have one in his hand to like squish it, and one in his mouth. He would run to his room, look under his crib, find one, put one in his mouth, take the other one out, take another one, put it in his mouth, constantly go back to his dresser, because I would try to keep him contained in a box in his dresser drawer. He'd open the drawer, he'd grab another one, constantly a pacifier in his mouth at all times.
Okay. So we do have a weaning guide, and I know that was one of the first things that you did try to tackle. So the free weaning guides at marybarbera.com/wean, and you now have him just with pacifiers at night. Is that right? And naps too, or no?
Yes, naps. Yeah, sleeping.
Okay. So that was quite a endeavor and an accomplishment. And did you use these steps?
Yes.
Did you have to modify them?
Not a lot, honestly. Instead of him like putting a pacifier in his box, I just kind of take them and throw them in there, and then I'll give him like a drink of water or a cracker or something like that.
Trade off. Okay,
yeah,
time to
exactly
give mommy your pacifier. So we have, sometimes kids are more likely to be like, put it in the passy box and decorate a box, and then that goes up into their closet up in a high shelf. That way they know that it's just there. But so Izzy adapted that, and she just says, give mommy the pacifier, and she trades off with something else that's highly reinforcing. So is he now, and part of the thing with pacifier weaning is you got to get rid of all those hidden places that he has or you have.
Yep.
And and just get rid of them.
Right. So I just make sure like when he wakes up, it's like, that's the first thing I do. Grab them all, put them in the box, put them in the closet, done.
Yeah. So. And the other thing is, years ago, decades ago, when I go to little kids' houses, there was this one boy that was like so addicted to the pacifier, but I didn't know that because when I showed up, like I was brought in because the early intervention people were like ding dong scream, right? So I go in, and I start assessing, and I mean, probably screamed when I got there. I don't know the very first time, but he was just so like off. Like, why is he so like, I'm trying to deliver reinforcement and whatever. And she was just like, okay, are you done? And he went into the other room and he went under the sofa and he grabbed the pacifier and he's sitting there sucking it, and I was just like, oh, okay, I didn't know you used a pacifier. Like, and then she described her whole procedure of 15 minutes before the therapist would come, he would turn off the TV, get rid of the pacifier. And so the therapist was basically an aversive stimuli, right? Ding dong. He was already upset because all the good stuff in his life ended, and then ding dong, and then when they left he got his pacifier back. So the key with that is to really rein in to where you have control over one or two pacifiers that wean him. So is he doing okay with the pacifier now?
Yes. He does whine a little bit if I take it every once in a while, but then I just kind of turn it to a game and I'll run in the hall and then I'll play peekaboo with him or whatever. Definitely still very chewy though, now that he doesn't have something in his mouth all the time.
So he's picking up other things and mouthing and chewing on them.
Yes, but also like his wrist or his arm. But I will say he is young. I think he is teething because it comes and goes. It's not all the time.
Okay.
So it's possible because sometimes he'll like stick a finger in his mouth and I feel like that's a little bit more teething.
Yeah.
But he does love to put like metal in his mouth. So I have definitely watched your videos on like chewing. And so I've ordered zinc.
Yeah, and you can get so we will put that in the show notes. We have a mouthing and we have chewing. We also have a pica thing. He's not like swallowing unedible things yet, right? Okay.
No.
So but I did do a podcast episode. It was a two-parter with a woman named Zolika. It was 201 and 202, I think. And she has at the time like a 4-year-old, and he was like obsessed, just mouthing a lot and always chewing on stuff and chewing on his shirt. And we had similar problems with Lucas too. So like, especially when you wean from a pacifier, because then they're looking for other things. And in Zulika's case, I recommended, which I normally don't, like as a registered nurse, I'm not like going to give you any kind of medical information or medical guidance, but it just seemed so like obsessive that I was like, well, I would make sure, like, get a blood draw for zinc, copper, lead, iron, magnesium. And she did. So she did at the end of the episode of one of it was a two-parter. And she said, no, what should I ask the doctor for? What lab specifically? And I'm like, oh my gosh, I don't want to give this kind of advice, but I did. And I'm like, I'm going to cut that out. Like, cause I don't like to do that. Well, then 3 days later on TikTok, Zulika goes on and says that both of her kids, she took them for lab work. And both of her kids, her son with a speech delay and her son with severe autism, both had high lead levels.
Oh, wow.
And like reported to the health department. That's how high their lead levels were. And so I left it in the podcast. And now, yes, it could be teething, but it could be an imbalance. And I would definitely look into that for
And
any.
I've already contacted my pediatrician. So yeah, we're gonna get a test.
Yeah, I definitely would. Okay, so we covered weaning, we covered mouthing. Another couple things that we should cover is brushing teeth and hand washing, because he has had problem behaviors. Those are the self-care chunk of the assessment, daily living skills, and they're super important for, I think one of the mistakes people make, parents and professionals make, is focusing only on talking, only on communication, and not enough on the self-care. Because if you get a Vineland done, or you get any kind of testing done for autism or for anything else, intellectual disability, for instance, a lot of that is based on whether they're, not potty trained at 4, or not washing their hands, or having a fit about a lot of things. And plus, leaving all assessments aside, you're gonna have a better time in your life if he's happy and he's willingly participating, and sanitary wise, if he's able to wash his hands. It's important for preschool. It's important prerequisite to potty training. So hand washing, you watch the hand washing bonus video, which I actually have on for free at marybarbera.com/hand washing. It's a bonus within our course, but I made it for free during COVID, when, hand washing obviously became a bigger thing. And you just sent a video of him and you really making some major progress with hand washing. Can you tell our listeners about that?
Yeah, so he never enjoyed washing his hands. We would just kind of like take him to the sink, and he loves water. So we were just kind of like, why, when I bring you to the sink and we lean over to wash our hands, we are screaming, we're fighting back, we don't want to do it. And so, yeah, so I watched the video, and literally the first time we tried it, I mean, he has a smile on his face. He thinks it's a game, like it's fun. He goes into the bathroom now and like will go up on his step stool. He can't reach the sink because he's still really small, but he'll go up on the step stool, and like that's what he wants to do. He wants to wash his hands. So it's
Yeah.
just,
And in that video, I show, little Cody, where we did a task analysis, which is basically breaking down the whole task into step by step. And then each step, we decide on what words we're going to use, like pull sleeves up. And each step can be only 5 words, which is a tag teach thing. And just make it fun. And I think half the battle, especially for, 20-month-olds, 21-month-olds, or any real age, if they're fighting self-care, is just to get them comfortable with you prompting, you helping, because, and even the early learner materials, even if he's not saying anything, if he's allowing you to gently prompt his hand to put the card in, or gently prompt his hand to put the puzzle piece in, or help him turn it, that resistance to prompts can make kids much more temperamental. And so allowing prompts, making things fun, whether that's at the table or away from the table, is really key.
yeah.
Yeah. So I think those are the big things. I do think now you do have ABA going to be starting soon. You left that assessment, weren't thrilled with the drive, but you did work with that organization to provide home ABA services, which haven't quite started, but you are concerned because, and we were chatting beforehand, because he is really anxious when people come into the house. And so you're feeling like, I'm going to do this kind of Mary's way. And then, how helpful are they going to be? And as the child gets older, you really do need, 10, 20 or more hours a week of ABA for a child to have the best outcome. However, if the type of ABA that's coming, or the people that are coming, aren't willing to take your lead and have the child be calm and not crying, is that kind of summarize what we were talking about before hitting record?
Yeah. exactly. The biggest thing is just when people come into our house, he'll hand lead or cry or pull me to a different room to get away from the situation. And so my biggest concern was, by having all these therapies come to our house, where it's better than going to a clinic, is it still what's best for him as far as learning and forward development? Or is it best for me just to, you know what I mean, continue doing what I'm teaching him and making progressions there, and then,
Yeah.
just continually seek guidance as I have trouble, kind of
Yeah.
thing.
And unfortunately, most places aren't set up like that. Most places are set up where you get the BCBA and then you get 10 or 20 hours of RBT, and they have to come a certain amount, and they've got to do all this special documentation, and then to say I'm going to do it myself is a risk, because then you basically withdraw, and then insurance is like, well, I guess they don't need it. And it's such a hard thing. But I think there are things you can do now. Keep going with the course, keep going with the group coaching, and get him comfortable at the table with you with the early learner materials, get him babbling more, take data on his babbling, add shoebox cards based on his babbling, just really make it fun. Get, higher step stools so he can be more independent with the hand washing, and same with toothbrushing. Toothbrushing and hand washing are pretty similar, but I would really perfect hand washing before although you don't want him screaming with toothbrushing. So maybe even just, getting different, electronic toothbrush. And we did a podcast where we talked a pretty good amount on toothbrushing. So you can do that. But the other things you can do is, when a therapist comes into your home, you could even have, a bag of special toys that he hasn't seen, or really great edible reinforcers that he usually doesn't get, and like special things that gets pulled out only when the therapist arrives. Or even that could come out before the therapist arrives, and then they could just come in and sit down while you're playing with him. Like, it's really a demand fading situation, a pairing of the situation. The worst thing that you can do for a kid like Benson, and for really all kids, is for them to come in and be like, okay, you're going into your, into the basement or into your bedroom, and we're closing the door, and you're going to scream, and we're going to do therapy. I don't care what you call that, whether it's ABA, speech, developmental therapist, the child should not be screaming. The parent, especially parents who are willing and able to be involved, should be involved. And there needs to be a careful, like, mommy's going to sit at the table with Benson. All the person is going to do is sit on the other side of the table and not really say much. And that person can actually deliver reinforcement, to start pairing things.
That's
But
a good idea. Yeah.
start doing really fun things when the therapist comes, like, but make sure he's quiet, even if he screams when they're there. Okay, shh. And once he calms down, okay, we're gonna do finger paint, because that's something he loves. Or let's go show Susie how we wash our hands,
Mhm.
because he now likes that. Let's get a snack. And just think about, like, really, how can we gently move that person in so that they can become almost as reinforcing as mommy. And for some kids, it takes more than just, a quick little switcheroo.
I did have a question. So we go to gymnastics once a week, and he has loved it. We've been going once a week since May. But last week, out of nowhere, he was screaming immediately as we go through the door. And he picked up my bag, picked up my shoe, and just was crying and just standing there, because, like, he knew that that's how we leave. And so, not really knowing how to react, I was like, well, if you want to leave, like, let's just leave. So we did. We left. We tried again this week, And same thing, he was like crying when we got there. And so I was like, come on, like, let's go play, let's engage a little bit. So eventually he kind of stopped crying and we were able to engage for like 10 minutes. But then immediately he's never done this, but he went right to the door. He picked up his shoes, he brought them to me, and he handed them to me. And I was like, well, what am I supposed to do? Like, if this is what you want, then this is a fun activity. I don't want to force you to do anything. But I just think that was weird. I don't know.
Yeah. And sometimes things can happen, like in chapter 13 of Turn Autism Around, I talk about desensitizing to doctors, dentists, haircuts. And, Michelle C's daughter, Elena, started to have like screaming for the bath all of a sudden. It's like, what is happening? And I said, was she held down for an ear check or at a doctor's office, or maybe he went somewhere else that had nothing to do with gymnastics, but he wanted to leave and he was screaming, and that just kind of spilled over. So some of the things you can do to repair gymnastics is maybe you could go when there's no class. Maybe you could talk to the director or whatever and just say, we just need to repair the situation. Maybe if they roll the ball back and forth, you could practice at home rolling the ball back and forth. Or like I even bought one of those parachutes and stuff. And it might be hard because if it's just you and him, you're not gonna be able to do the parachute, but that might be good when a therapist comes. You could do more like kind of similar activities to get the activities repaired, and maybe go when there's no kids there to, it's probably just something happened that was aversive that spilled over there.
Sure.
But, sometimes you just like, don't know. And then you're like, should I push this? Should I sign up for next time? Should we, and it depends,
Sure.
Yeah. All right. Well, I think we got through a lot. So what are you hoping for the future? Or what are you thinking? Where do you go from here?
We're definitely going to try ABA. We're going to give it a shot. Same with speech and OT. Definitely just stay in your classes. And just that way it can guide me to making sure that I'm present when he's at therapy, and kind of knowing what to look for and what not to like push him with, if that makes sense. And then I'm just hoping that we start talking a little bit, because I know that is 100% of his frustrations is he can't communicate the best. And so, if he can talk, I mean, his tantrums are going to be 0.
Well, let's hope.
Yeah.
I think he had a pacifier in his mouth 24/7. He has that out now. That's good. You are making progress with a lot of different things. He's babbling more, and you are learning to be the captain of the ship and become his best teacher and advocate for life. So just keep going. Love gung ho moms. And thank you so much for sharing your son's assessment and plan to help other people. Even coming on the show is just a big win for our listeners, because we can hear it firsthand that, especially with a dedicated parent like you, the kids can make a lot of progress, and the sky's the limit. He's very young. And so I'm looking forward to having you in our community for a very long time. So thanks so much. Oh, before I let you go, we always end the same way. Part of my podcast goals are to not just help the kids, but also help the parents. And do you have any self-care tips or stress reduction things you do as a stay-at-home mom to kind of ease your stress a bit?
We have a wonderful sitter that comes to the house Monday, Wednesday, Friday for a couple hours in the morning. So I'm able to go get coffee, go to the grocery store, just kind of get out of the house, because Benson does not like to leave the house at all. it's just too difficult at this point until we kind of can work on that a little better. But I also have wonderful family that I talk to all the time. And I'm a big runner too, so I run quite a bit.
Nice, nice. And the way you paired your babysitter
Hmm.
is the way you pair therapists and things like that. So that's great that you have a person coming
Yeah.
that is regular, and you can begin to show her how to do the shoebox and potato head and all that kind of stuff too. Once you and Benson get a system,
Hmm.
you can begin to train other people, including the babysitter,
Oh
which is
yes, I've already told her all about everything. So she's actually a speech pathology student at the university.
nice.
So I'm
Perfect.
like, and you're going to be a speech teacher when you graduate. It's perfect.
Awesome. That's awesome. All right. Well, thanks again, and I wish you all the best.
Thank you so much.